So hi and welcome to the first video presentation, which is looking at an overview of the structure of the years of medical school at the University of Bristol. So in this first presentation, we'll take a bit of an overview, a bird's eye view of the course structure over the 5 years. And then in the next two presentations, we'll gradually zoom in. So in the second presentation, looking at the context of year 4 and the structure of placements within year 4. And then in the third presentation, we'll look more specifically at the teaching we provide during their year 4 placement and course in psychiatry. And so a bit of background about the students. This is just to say that the university's entry requirements for medicine are quite high in terms of students' academic ability. The university requires students to have achieved 3 A's or higher in their A levels, and there's quite a high competition ratio for places, as you can see there. There's a requirement for students to have studied chemistry plus another science subject, and there's also an acknowledgement that these kind of high academic requirements exclude some students who might not have had the opportunity or support to achieve these by age 18 because of factors in their background. So there is a widening participation scheme available to a limited number of students per year. And on this scheme, students may not have studied science subjects, but the course includes an extra year where they study the subjects and then join the first year of the medical school after that. So like all undergraduate medical courses, the medical school course at University of Bristol is a 5-year course. The term for the degree is MBCHB. That's just to let you know in case you see that written somewhere else. And the other thing I'm just mentioning at the start here is that there's a certain group learning format, case-based learning, which run throughout of all of the 5 years of the university curriculum. We'll come back to this in both of the other presentations, but I thought I'd mention it at the start here. In essence, it involves students being given a patient story or case and then working through questions around that case as a group. So it's like a group problem solving exercise together where there's not so much a teacher but a facilitator kind of helping that group work through the questions. Okay, so let's have a look at the structure of the 5-year medical course. Before diving into each year, I just wanted to point out, as I said, that case-based learning is an approach that runs throughout, and also that there's a pattern of, in the first 2 years, most of the time spent in the classroom and a little bit of time on placement every now and again, and then years 3 onwards, that's reversed, with students spending most of their time out on placement and the minority of their time in the classroom setting. So let's look at year 1. So all of the years are taught in modules, and year 1 will go through different modules looking at different bodily systems. But the core question students are asking in year 1 is, how does the human body work in a healthy state? What is the anatomy, biology, physiology of the heart in a healthy state? In year 2, students bring in the concept of disease into the learning they've done in year 1. So they might think about how the heart changes during a disease in terms of its chemistry, physiology, anatomy, and how that connects to a patient's symptoms that they might be experiencing. So the question there put there is, why did the patient have chest pain? In year 3, students are predominantly out on placement in what are considered the kind of core medical specialities, so heart, lung, gut, medicine and surgery, and they'll be in placements in acute general hospitals. And they'll be learning about, shadowing doctors, learning about their consultation skills, management of patients as well, treatments that doctors recommend. In year 4, they're then out on placements in what are considered the specialities, of which one is psychiatry, and others include pediatrics, reproductive health, geriatric medicine, and general practice. In year 5, students then take on a shadowing role, in effect, which is a preparatory for the role that they would do as in the first year of being a junior doctor the year after. Right, so that's an overview of the 5 years. The other thing to mention here is that this isn't all inclusive, there are also things like helical themes running through the 5 years, by which I mean a theme topic that's introduced in year one and elaborated on gradually through the 5 years. So these include medical ethics, medical law, holistic care, and self-care, and stigma, among others. So this is an overview of how psychiatry fits into the 5 years of the course. So in the first years, I'll be learning about a little bit about the physiology, anatomy of the brain, and a little bit about psychology, how stress works. In the second year, they have their first kind of block of psychiatry, around 2 weeks, focusing on anxiety and low mood. This includes lectures and group work, but also includes a clinical contact day where students have the opportunity to meet an EBE, to meet a psychologist or psychiatrist as well, and have a virtual tour of Cannington Road Hospital. In year 3, there's just one kind of day of psychiatry, which is teaching, which is based on liaison psychiatry, so psychiatry in the acute hospital. The year 4 is the focus of our work, our project, and it's where the students get the vast majority of their mental health experience. So we'll go into the year 4 psychiatry course and placement in the further presentations. And then in 5th year, there is no formal psychiatry course or teaching, although students will be coming across mental health issues when they work in their GP and hospital medicine placements. Just wanted to map onto this as well, the examinations that students go through. So starting at the end of year 2, they have a written exam and they have to pass this to progress to year 3. At the end of year 3, they have an OSCE that they have to pass to progress to year 4. Then at the end of year 4, they have the OSCE and MLA, which are practical and written exams, respectively. And these are their final exams, so define their final marks. And the PSA, is a prescribing exam that students have to pass at the end. But generally, it's something students pass. It's not a major. It's considered a major exam by most students. So just to go back, I've thrown lots of acronyms at you. So the MLA at the end of year 4, these final exams, the MLA is a standardized written exam. It's a multiple choice exam that's set for students at all medical schools. So it's standardized externally, and all students in medical schools across the UK complete it. The OSCE is a practical exam, so it consists of 10, 12 stations or patient scenarios where the student walks into a room and there's an actor playing a patient, there's an examiner with a mark scheme, probably won't say much, and there's a clinical task that the student has to do. So it might be take a history from this patient with chest pain and prescribe the appropriate treatment. And they have to do that, usually quite time pressured, in about kind of 7 minutes. They have to do that with the actor and then move on to the next station. So medical students finishing medical school then start work as junior doctors. And the first 2 years of their work as junior doctors is termed foundation training. During foundation training, students do a different job every 4 months, so cover 6 jobs over the 2-year period. The different jobs are in a variety of areas of medicine. So they might be in the hospital, working in heart, lung medicine. They might be in the community, working in psychiatry or GP or sexual health, for instance. So there's this broad range of specialties, and the idea is to give students a broad range of experience before the doctors at this stage, a broad range of experience before they start to specialise. So after these 2 years, many doctors take some years out actually after the 2 years of foundation training and get some extra experience, many in Australia or abroad, as you might have kind of come across. But after those 2 years, the students can choose to apply for specialty training. So to enter a training program to become a GP, a surgeon, a psychiatrist, a cardiologist, or etc. And these training programs take anywhere between 3 to 8 years. And again, during these training programs, students will be rotating through different jobs with different teams to build up the relevant experience. So once doctors have finished their foundation training and then these specialty training programs, they can become consultants or general practitioners. Okay, so thanks for listening to this first video. I hope it's been clear. If not, please get in touch with any questions. I'll attach some relevant resources in the text below.